Hello everyone, it's Dr. Tracy Schroyer, and hopefully it's not too loud. I'm driving home from the doctor's this morning, and every 6 months I've been going to see my oncologist, and we just passed the 2-year mark since the time that him and I got to see each other, which was about a month after my double mastectomy and starting reconstruction. And everything looks very good. I have not had pain, thankfully. My joint aches have gone away for the most part. Every now and then I will have them, but they haven't been as bad as when I first started some of the hormone blockers, so that is great. And whenever I go to see him, he asks how I'm doing. They take your normal vitals, and he feels my chest and my stomach to make sure he doesn't feel anything strange. The biggest sign, if I was to have a reoccurrence or if it metastasized, is pain. So any pain that I have for a prolonged period of time, so a couple weeks or more, then I need to contact him, and we need to probably do some scans and things like that. There is no protocol for doing regular blood draws. That doesn't really tell you as much from my doctor's perspective as much as like if you're feeling pain and you do scans. So there's a lot of faith involved in this journey, and I share so much about my breast cancer journey because I was very, I don't want to say dependent, but I was very, it was very helpful for me to watch videos from others like Jen Rosenbaum, a girl named Heather. They had different stories on YouTube about their journey, and everybody's is different, but you can gather some insight from everybody's journey, which is so helpful. So I have been able to share that through my YouTube channel and sharing those videos. So this is going to go alongside that as well as in other areas to help people. So if you are a woman or you have a woman in your life, mother, aunt, sister, spouse, anything like that, I encourage you, if they're 40 or older, or if you have a history of cancer or breast cancer or anything, that you encourage them to reach out to their doctor to get a mammogram. My very first mammogram saved my life. That is where they found that I had a tumor, and when they did my surgery, they actually found 2 tumors and abnormal cells growing in my other breast. So it is so true that a mammogram can save your life. I am living proof. They caught it early enough. It was stage 1B, and we were able to make decisions, intelligent decisions based on, I looked at a lot of the research that was out there, and with my case and other things I've seen, to determine what to do. So I just want to share that with everyone. And what I did learn today in this breast cancer learning journey is I had talked to my oncologist, and I asked him, I was like, I thought it was at the 2-year mark that you changed from seeing him every 6 months to seeing him once a year. And he said, typically I see my patients every 6 months for the first 5 years, and then yearly until year 10. I was like, holy shit, which I'm fine with. I want to be preventative, and if we find anything. But he asked, I said, are we able to go annually because I've been doing so well, and then if anything pops up or I feel anything or I have pain that I reach out? And he said, I'm willing to do that if you still see your breast surgeon. And I typically don't see my breast surgeon. I see a nurse practitioner in her office, and I see her, and I've graduated to once a year with her. So my next appointment with them is in January. It's May now. So he likes the idea of having that once a year with him, once a year with her, and it's staggered. So every 6 months I'm seeing somebody. So he was good with that. And so I'm going to see him next May. And he said typically around the 2-year mark, I will have another bone density scan, which I had shortly after I saw him initially. So it's been almost 2 years now. So he said we have to wait until, I think, after July. It must have been July 2 years ago that I had the bone density scan. And the reason for the bone density scan is because the hormone blocker that I take, which a lot of times you'll hear medications you get on and they cause other problems. Well, the hormone blocker can really do damage to your bones. And some people can get arthritis or I think other issues. So they do keep track. He said every 2 years they'll do a bone density scan, which I was shocked when I went to do it, how quick and easy, and it's not painful at all. You keep your clothes on, you lay there, and they scanned like one of my legs all the way down and like my hip area. And that was kind of it. And it was done in like maybe 10-15 minutes. So it's pretty quick and easy. So he said we would do another one and compare it to the first one, kind of see where things are. I don't know that they would make any change as a result of that, but if there's any kind of red flags that pop up, then you could talk about it. And is there another medication you go on? Is there any kind of therapy, anything else that you would do as a result of what it's doing to your body? So thankfully, knock on wood somewhere, everything has been going very smoothly for me. I am very fortunate. And so a really good report on my oncology appointment this morning. And it'll be another year unless something pops up, God forbid, that I will go back to see him. So wanted to share that. And please, again, if you are a woman, if you know a woman, everybody has women in their lives, please ask them about the mammogram. For some people it is painful. Sometimes it depends on how dense or not dense your breast tissue is. It wasn't so painful for me when I had done it that first time. I don't have to get them anymore because of my implants. They would do other kinds of scans if I had pain to see what was going on. But I know other people that thankfully they've gone and gotten them. They say it's typically normal, and for me, I had even gotten the news that it's normal on your first mammogram that you would be called back, and they might do an ultrasound to check things out. So even when I went for my ultrasound after my mammogram, I wasn't concerned because they said it was so normal. It was when we had to go and I had to do the biopsy that I started to get a little bit worried, but I still was like, oh, I think this is common. And that's when we got the news about everything. So please do it. It could save your life, or it could save your loved one's life. It's well worth the time that you need to take out of your day to do it. So that's my PSA for the day. And I hope you all have an awesome day and an awesome week. And I'll see you later. Bye.